All right, let's dive right in. Today, we're playing detective, and we're heading into the world of medicine to solve a mystery. A mystery that might just be happening right inside your own mouth. Every great mystery starts with a single clue, right? And for this one, it's something super common and, let's be honest, sometimes a little puzzling. I mean, haven't we all been there? You're just brushing your teeth, minding your own business, and you spot a weird bump or sore, a little patch that you swear wasn't there yesterday. It's this tiny little mystery that can honestly cause a whole lot of worry. So who's the detective that cracks these kinds of cases? Well, that's exactly where our health detective steps in. We're talking about a really specialized field called oral pathology. So what is that exactly? Basically, oral pathology is the branch of dentistry that's all about diagnosing and studying diseases that affect your mouth, your jaw, and all the stuff around them. You can kind of think of an oral pathologist as a super specialized detective. Their whole job is cracking the toughest cases when it comes to your oral health. And you might be surprised by just how much they look at. Seriously, it's not just about your teeth. These specialists are investigating everything. We're talking your tongue, gums, jawbones, salivary glands, and all those soft tissues lining your mouth. It's like a full, comprehensive sweep of the entire scene. And this is a really big deal, probably bigger than you think. This isn't just about figuring out a canker sore. No, this field is actually a critical window, a look into your entire health. It's wild, but your mouth can reveal so much about what's going on in the rest of your body. Think about it. It's got a rich blood supply, cells turn over super fast. It's this incredibly sensitive place where changes can show up really, really quickly. In fact, a lot of the time, it's the very first place where serious health problems leave their first clues. For instance, did you know that the first signs of some major conditions like diabetes, anemia, even HIV/AIDS can actually show up as subtle changes inside your mouth? It's true. And the same goes for some chronic inflammatory conditions. An oral pathologist, well, they're trained to spot these clues way early on, and that can be absolutely life-changing. Okay, so let's check out the rogues gallery, if you will. Let's look at some of the usual suspects these oral detectives are dealing with day in and day out. All right, here are a few of the big ones. You've got your everyday canker sores. Super painful, right? But they're usually harmless, often just tied to stress. Then you have something like oral thrush. That's a fungal infection that can pop up with those white patches, and it's often a sign that your immune system is a bit down. But then you get something called leukoplakia. Now, these white patches might not look like much, but they can be a serious warning sign for precancerous changes. And that leads us to the most wanted, the most serious suspect of them all, oral cancer. It's so tricky because it often starts out really sneakily, maybe just a small sore or a little spot that just doesn't heal. This is exactly why having the trained eye of an oral pathologist is so incredibly important. Catching this stuff early, it's not just important, it can literally be life-saving. So, let's say a suspicious spot does show up. How exactly do these detectives go about cracking the case? Well, it's not guesswork. It's a very methodical, scientific process. The investigation really boils down to 3 key steps. First up, they do a really thorough clinical exam and look at your medical history. Then, step 2, if something looks off, they'll do a biopsy. That just means taking a teeny tiny tissue sample. And finally, step 3. That sample goes straight to the lab to be put under a microscope. And what they're looking for there is cellular evidence. Things like weirdly shaped cells, strange growth patterns, clues that really tell the whole story. And that's not all they've got in their toolkit. They also use advanced imaging. We're talking X-rays, CT scans, to see what's happening under the surface. This helps them get the full picture and make sure they have all the evidence they need to make the right call. Okay, so we've talked about the detectives, but now let's talk about the most important person in this whole story, and that's you. You are the absolute first line of defense when it comes to your own health. So how do you do that? Well, the good news is it's not some big secret. It's the stuff we know we should be doing. Consistent brushing and flossing, making sure you see your dentist regularly, and steering clear of big risk factors like tobacco and too much alcohol. Of course, a balanced diet and keeping any chronic conditions in check, that all plays a huge role too. So here's the most crucial takeaway from all of this. It's really simple. Just pay attention. If you ever notice a sore that's just not healing, or a lump, or some weird red or white patches in your mouth, please don't just ignore them and hope they'll go away. You have to be your own health advocate and get it checked out by a professional. When you think about it, your body, and especially your mouth, is always talking to you. It's constantly sending signals. So the real question is, are you listening?